Good evening and welcome to our COVID-19 update. I am Ladi Akiridoluale. Here are the highlights at this hour. Medical health workers in the Lagos University Teaching Hospital protest alleged disparity in percentage hazard allowance payments. Interstate travel resumes nationwide amidst complaints about cost of compliance with COVID-19 guidelines. And United Kingdom reports lower confirmed case numbers, but also the loss of over 12,000 jobs in 48 hours. We begin in Lagos, where members of the Medical and Health Workers Union of Nigeria, the Senior Staff Association, and non-academic staff of the Lagos University Teaching Hospital are protesting an alleged slash in their COVID-19 hazard allowances. The groups claim that the federal government's agreement to pay 50% of basic salaries as COVID-19 hazard allowances was fulfilled with other categories of workers, while they were only paid 10%.
When they want to pay benefits to health workers, the promised benefit for special COVID-19 COVID-19 hazard allowance and inducement. Some category of health workers were classified as non-essential, which is not right. Are we going to say that a record officer is not an health worker? Are we going to say that a dietitian is not an health worker? Are we going to say that a medical laboratory scientist, a medical laboratory technician and assistants are not health workers? Are we going to say that an anesthetic technician is not a health worker? These are the group of individuals that will be paid 10%. Government promised 50%, and we deserve 50%. Lagos University Hospital is one of the isolation centers for COVID-19. It is sad that apart from the doctors, the nurses, the lab scientists, and physiotherapists and pharmacists, all other workers in the hospital were paid 10%.
The Lagos State Commissioner of Police, Mr. Akim Odumosu, has been speaking on the next line of operations after the lifting of the interstate travel ban. Mr. Odumosu explains that the enforcement on all COVID-19 protocols will continue.
We've already done our own planning. We have been in it. So what we are now doing is that since we are now going to have free movement from one part of the country now to another, so we are now going to emphasize on our traditional security strategies. So not only, it's not going to be a free all the while. So what we are using now to stem the crime in the state is what we are going back on. It's not going to be a reduction in that. Like at the entrances now, where they're coming in now, at the border town now, we may relax all those ones. And relaxing them now does not mean that we are removing the men completely, because it could be a source of criminal activities or bringing in now prohibited firearms now into the state. So we are still going to maintain, but it's not going to be fully on COVID-19. So now the social distance now, fortunately now, we are meeting the union leaders now. So those that have not been banned now, so meet the union leaders. So they have a ways of enforcing. We don't have the time now, we have been saying that enforcing the laws on COVID-19, so it's just on humanitarian enforcement. I will continue to advocate this. So with the Commissioner for Transportation, with the SCM Transportation now, with the leadership of Lagos State, the LASMA, and the union. So we are going to go into that enforcement of that social distance in the vehicles. Because they know, I said that they know how to get themselves now disciplined. So that's what I do for that. So the union members now, that's social distance. I think the face mask now, so you see now, since the advocacy that where, finally yesterday I discussed the Commissioner for Information now about more advocacies on this. So people will not just say that they can move, they can do anything without. And in our own enforcement, I'll give you the breakdown of 206, 208 that were arrested for not wearing face masks. We shall continue to use that persuasive enforcement to make sure that people have this. And those arrested for not maintaining social distance, this shall continue so that we continue the spread of the virus.
The Lagos State Commissioner of Police, Mr. Akim Odumosu. Well, motor parks in Kaduna metropolis are back to life following the lifting of the ban on interstate travel imposed by the federal government in order to curtail the spread of COVID-19. You would recall that the motor parks were closed on March the 26th due to the state government's restrictions, except those on essential duties. Our correspondent spoke to some of the transport workers affecting the safety guidelines and what the new normal looks like for travelers and other business activities around the parks. We also take a look at the situation in Anambra State.
It's a brand new day for commercial vehicle operators, travelers, and commuters as it brings with it an official resumption of operations following the lifting of the ban on interstate travel by the federal government. At the popular television garage in Kaduna, northwest Nigeria, quite a number of persons seem to be working in line with the laid-down COVID-19 protocols. Drivers are expected to carry only 2 passengers per row and the mandatory use of face masks, among other safety guidelines. However, these measures, they say, is unfavorable to them.
If you're going to carry 8 passengers, carry 5 people, I don't know how possible we'll continue in this. It's affecting all the drivers.
In terms of palliative, the government is not ready to give palliative. The best way is allow people to go out gradually, as they have been doing.
In Anambra State, southeast Nigeria, transport operators have commenced business after a long period of interstate travel ban occasioned by the COVID-19 pandemic. Now that business has started, it is observed that the level of precaution is being applied at the parks. Passengers at the transport company of Anambra State wash their hands, apply sanitizers, and undergo infrared checks.
Once you are checked and your temperature is above the stipulated temperature, definitely will ask you to decline your journey and go and take proper care of yourself, because it's life first. Then another measure we put in place is that adherence to what the federal government said in terms of conveying commuters. First of all, we must make sure that each of our vehicle carries 2 in a seat of a vehicle.
What is expected is that the people will be consistent in adhering to all the COVID-19 protocols to contain the spread of the virus.
We've got some breaking news out of the nation's capital. The federal government has just announced that the resumption of domestic flight operations at Abuja and Lagos airports will take place next Wednesday. That's July the 8th, 2020. The Minister of Aviation, Captain Hadi Sirika, says Kano, Port Harcourt, Owerri, and Maiduguri airports will begin flight operations on Saturday, July the 11th, while other airports in the country will resume on July the 15th. Once again, the federal government has just announced that domestic flight operations will resume in Abuja and Lagos next week, Wednesday, July the 8th, 2020. Kano, Port Harcourt, Owerri, and Maiduguri airports will start flight operations on Saturday, July the 11th, while other airports in the country will resume on July the 15th. Let's return to interstate travel, which of course has some relationship with air travel. The Presidential Task Force on COVID-19 on Monday lifted the 3-month-old restriction on interstate travel with new guidelines that will regulate the operations of motor parks and commercial vehicles. Some of these guidelines require that drivers reduce the number of passengers in their vehicles, check temperature, and ensure that hand sanitizers are provided for passengers before boarding. Our next report examines the level of compliance as transport operators officially resume interstate travel in the nation's capital.
The popular Utako Motor Park in Abuja comes alive again after 3 months of inactivity due to the restrictions on interstate travel by the federal government. This is a point for people to sanitize their hands before entering the motor park, as officials of the Nigeria Union of Road Transport Workers also check vehicles for other safety protocols. Although these provisions are made on the first day of the reopening of business, not everyone here is complying with the safety protocols.
When they come to the park, you ask them to want to sanitize in there. They say they are not affecting with this coronavirus. But it's not the best. We need a maximum cooperation. Whenever they come, they should obey and rules and regulation of the motor park. Because before you enter the vehicle, we have to check maintain you, going to get and sanitizing you before you come and enter the vehicle.
We put 2 on the seat. So the whole bus is taking 9 passengers instead of 14 passengers. We have to comply with the directive of the federal government. Where we used to carry 6,000 before, we put only 2,000 naira. From here to Lagos, we carry 8,000 naira.
Some drivers also speak about low turnout of passengers, as well as the effects that the reduction in the number of passengers per vehicle has on their income.
They tell us, make you not carry overload, make you carry normal passenger, 5 passenger, so I not carry plenty money.
When the Presidential Task Force lifted the ban on interstate travel on Monday, it also announced the new guidelines for transport officials. These include, but are not limited to, a compulsory provision of hand-washing facilities, a compulsory use of face masks by travelers, and vehicles to load only 50% of their full capacity. While these guidelines can guarantee a measure of safety in the motor parks, the enforcement of these protocols is a challenge that the government and motor park operators must take seriously.
More high-profile Nigerians are contracting the coronavirus, the latest being the governor of Delta State, Dr. Ifeanyi Okowa, and his wife, Edith. The governor, who announced this on his Twitter handle today, explains that they are well and remain in isolation while undergoing medical treatment. This is coming almost a week after his daughter tested positive for the virus. Only yesterday, Dr. Okowa's counterpart in Ondo State, Governor Rotimi Akeredolu, also announced on his Facebook page that he tested positive to COVID-19. Before these recent cases, the governors of Bauchi and Kaduna, as well as Abia states, had tested positive for the virus, while the Bauchi and Kaduna governors have since recovered. The Abia governor is still undergoing treatment. In Kogi State, the government there says its attention has been drawn to the unfortunate scuffle between staff of the Federal Medical Center Lokoja and some patients' relatives at the hospital this morning. According to a statement released by the government this evening, preliminary findings revealed that the violence ensued when relatives of patients in the medical facility protested against the failure of the management of the hospital to attend to them. Many people in the emergency ward were left unattended to, and a mother was said to have delivered at the gate of the hospital. That generated a lot of public tension. Tension had started building since yesterday when patients and their relatives learned of a plan by the medical staff to stage a protest today seeking protection from COVID-19. According to the statement from the government, it sues for calm and urges medical authorities to remain committed to their profession and responsibilities, as government will protect them in order to give them the confidence to deliver healthcare management, which must not be politicized.
They brought a pregnant woman this morning at FMC with some people. Then they were telling the doctor to admit the pregnant woman in the labor room. They now said that before they admit the woman, they should go and do coronavirus test. Then the family insists that their person does not have coronavirus. Then the doctors, they refuse to accept the pregnant woman. For the argument then the woman delivered at the front of hospital on the outside the hospital, on the ground, on the empty ground. Nothing like treatment, nothing like caring for the woman From there, the family of the woman and other people then provoke, start to dey disturb the hospital.
We'll take a break, and when we return, we'll widen the scope of our discussion, particularly now that interstate travels have resumed. We'll take a look at that and some of the figures coming out of the NCDC situation report. Thanks for staying tuned. Welcome back to our COVID-19 update. The Nasarawa state government has established a testing center in Karu local government area of the state. The center has a testing capacity of 40 samples per day. Our correspondent, Halima Gayam, has more on this and other updates.
Since its index case on April the 28th till this moment, 1,238 tests have been conducted in Nasarawa state, out of which 213 returned positive. These 213 spreads across 10 out of the 13 local government areas of the state. Karu local government area is the epicenter of the coronavirus in Nasarawa state. This may not be unconnected to the fact that Karu shares a proximity with the Federal Capital Territory, Abuja, which has the second highest number of confirmed cases in the country and the highest in the North Central region.
Now, thank God we used to take all our samples to Abuja, but thank God we have a facility now in Bingham University, also supported by NCDC, and the lab there can take 40 samples in a day. And we're working on establishing more centers. Hopefully by next week or the week after, we should have at least 2 or 3 more centers in Nasarawa State where those testing can be done.
The need to prioritize safety precautions is reiterated by Governor Abdullahi Saleh.
Government has continued to issue proclamations in an effort to curb the spread of coronavirus in our state. This is aimed at protecting the lives of our people against contracting this virus. As you may be aware, a report from the NCDC indicates that Nasarawa State so far has recorded over 200 cases. It therefore becomes necessary on all and sundry to continue to comply with the preventive measures and government directives in order to prevent further spread of this virus in our state.
A number of residents are denying the reality of the coronavirus. The awareness campaigns ongoing by the government would have to continue until the people get used to living with the virus and take personal safety more seriously. Halima Gayam for COVID-19 update.
In Yobe State, the government there says it has discharged all the patients of COVID-19 admitted at its isolation center located within the premises of the State Specialist Hospital in Damaturu. The COVID-19 Committee on Prevention and Control in the state made the disclosure while briefing journalists after its 14th meeting.
You can see that...
April the 30th, 2020, Yobe State recorded its first index case of the coronavirus, which the Committee on COVID-19 said the patient had no travel history to high-risk states.
Ready for use.
Few weeks later, the disease continued to spread across 10 local government area councils of the state. During the recent Muslim fasting period, the state witnessed sudden deaths suspected to be COVID-19 related, until when a survey was carried out and the results showed only 3% of the deaths were associated to COVID-19. Now, the state government have discharged all the patients admitted at Damaturu Isolation Center.
As of today, we have 61 confirmed cases, 48 discharges, 8 deaths. The state has so far tested over 170 samples.
The committee has also lifted the ban on interstate travel, as well as pledged to adhere to all of the reviewed federal government resolutions.
All schools will be open for students for JSS 3, SS 3 and Primary 6 preparing for common entrance examination. However, proper prevention and control measures against COVID-19 must be observed.
With this development, Yobe State now has only 5 active cases, but more safety protocol need to be put in place to curb transmission of the disease.
In a bid to ensure that quality healthcare delivery is felt at the grassroots, the Ebonyi State government has concluded plans to commence community identification program. Governor Dave Umahi disclosed this at Government House at Bakaliki while briefing Government House correspondents. The governor explained that the program will be activated across 171 political wards in the state to enable indigents of Ebonyi State access health facilities at their doorsteps.
No kobo has come in from anybody other than the ones we announced in televisions and radio, which is no more than 277 million, which all of us, donation of salaries of public office holders and so on and so forth. And then, so that is it. Knowing this, therefore, is to see how we activate our community identification program by probably using the political wards, 171 wards, buy 171 keke napep, buy 5 machines per each political ward, so that the medical workers and somebody from the Royal Highness in each community, on each ward, will be going with their machine to check every household on daily basis. Every household on daily. This is the only solution to this COVID. So that those who are sick are lifted immediately with the keke to the required testing center or to a center at the local government where the bus will lift the person to the nearest testing center.
Governor Dave Umahi of Ebonyi State. Let's talk now to a public health physician who is also a member of the Association of Public Health Physicians of Nigeria, Dr. Ajoke Adewale. She joins us via Skype from Isolo in Lagos. Good evening, Dr. Adewale. Thank you for your time. Dr. Adewale, can you hear me? Good evening, Dr. Adewale. Dr. Adewale, while we're trying to confirm that you can hear, let me ask the question. What have been your observations about the interstate travel that started or that restarted today?
I can barely hear you.
I'm talking about the interstate travel.
I would like the volume to be a bit.
No, I'm talking about the interstate travel that restarted today and some of the issues that it has generated. The cost of complying with the COVID-19 protocols, for example.
Okay, I heard interstate travel and about the challenges that are involved in interstate travel. I'm not sure that I heard everything completely. But if I may talk about interstate travel, I'd like to say that I'd like to definitely say that the regulated interstate travel is definitely one of the greatest steps towards easing the lockdown. But as we have noted from the beginning, all our interventions, all our restrictions, easing of restrictions should be done with care and with heightened awareness. I wish that I could hear you better, but I would imagine that we are looking at the impact of interstate travel on the current COVID-19 crisis in the country. So while it's a welcome event to gradually ease back to normal life, we know that COVID-19 is not going to live in a hurry, but there will be human beings that need to go on with their economic activities. We also have to, because of that, increase our awareness measures, our containment measures. So we want to make sure that the transport officers and all those involved, the stakeholders, are well educated concerning COVID-19 prevention, all the pillars of hand washing, wearing of face masks. We also want to enforce it. We want to make sure that it's not a case where we are telling them, oh, limited numbers in a vehicle, and now they're spacing out, and they're now, disobeying regulations. Did you hear me?
I did hear you. I did hear you, Dr. Adewale, and let me then take you in a slightly different direction. If you can hear me, one of the fears that people have had with community transmission has been that of this interstate travel, that those who are coming from high-impact areas like Lagos and some of those local governments that the NCDC identified as being high-impact areas could take the virus, now that they are allowed to move freely, to places where, for now, the incidences are much lower. Do you have that same fear?
Yes, the fear is not unfounded. The fear is indeed a valid fear. But what I would say is that the people that are easing these restrictions, when I mean the people, the stakeholders, the planners, the government, they are very aware of this fear too. And what people should, there will always be fears as long as COVID-19 is concerned. The world is not going to remain the same. So as much as we have these fears, what we need to do is to adhere to the guidelines. You know, it has gone beyond, we are not running away from COVID-19, it is here with us. So we can't say no travels forever. However, what we can do is to enforce our measures and also to increase our responsibility as citizens. Definitely, places with high influx like Lagos, Kano, Oyo State, Edo, Abuja, those are like the top 5 states. I mean, those with the highest incidence of COVID-19. Going to other states that have lower incidence, what is a fear. But what these states can do is to make sure that at the point of entry, I mean at the land borders, at the point of entry or borders to these states, all these measures are enforced, temperatures are checked, quarantining measures are in place for those with symptoms. You know, like we said, we have to move past running away from COVID-19, that, you know, and then face it head on with the right prevention and intervention measures. Was I able to answer this satisfactorily?
Yes, you did. You did. Now, I was just taking a look at some of the figures that have come out of the Nigeria Center for Disease Control in their situation report for the last 24 hours. Of course, this has been exactly the same situation almost since this started. It has always been that 2/3 of the demographics have been male and 1/3 have been female. Is that something inherent in the genes of the females that fights this virus, or is it simply an incidence? Is it simply a coincidence?
A coincidence that what? I missed a little part of your conversation. What is a coincidence?
I said, is it a coincidence that almost consistently 2/3 of those who have been infected are males and only 1/3 are females?
We await research, you know. A lot of speculation has gone on concerning the nature of even COVID-19 itself, that it's quite difficult to just make any unscientific, and, you know, because I'm a physician, I'm a public health physician, and this is a television station, I'd rather not make assertions that would be quoted. All I can say is we know that men have risky behaviors. They are the ones going out to fend for their children. Right now, it is most children are at home and most women are with their children at home, and it may not be applicable. So we still await research. All we can do is to tell men this is the data out there. This is what we are saying. So you are already, you know, we don't know if you are higher risk, but your gender is being affected more, and that's the reason why you should probably take more responsibility in protecting yourselves.
Let me ask you this as a throwaway. Going forward, now that we are moving in, I mean, just earlier in the news, we reported the fact that domestic aviation will restart next week. Interstate travel has restarted now. Some level of schools will reopen, particularly for the graduating classes. So some sort of normal is returning. Do you think that even if we comply with the protocols, we will not have a huge spike in numbers?
We with every sense of responsibility, I have to say that this is a risk that the government and stakeholders are willing to take, not unguidedly. I mean, we already know that these are high-risk events, and we are quite sure that, you know, some things may happen in between. But like I've said before, the most important thing is to institute interventions, is to make sure that, you know, as we are doing these graded steps, we are not doing this without data. So far, so good. We still have about 2% mortality of everybody that has ever been infected. Even though 2% mortality still represents people, it's safe to say that, our interventions they've been rewarding. Our hard work has been paying off. They won't have gone forward with a further ease of lockdown if we were not achieving some kind of progress or at least some plateau. Even though the numbers are still looking very bad, we have high recovery rates and we still have low mortality rates. And that is why this is being done gradedly. So domestic aviation industry is opening, interstate traveling is opening up, and we are looking at taking students in their final classes, taking them back to school. This is not without commitment from the government. I just want to encourage everybody listening to me out there. It may look bleak, and I know that people are definitely faltering in their protective measures. The government is looking I'm not saying this, I'm not affiliated, but I'm just saying this with the responsibility I see on ground. Whenever things like this happen, you expect a second wave or a third wave or another wave. But the most important thing is you've had adequate time to prepare for that wave. So I'm just hoping that as these measures are instituted, more people take responsibility, because it's not just about the government. People take responsibility to be extra aware of the risks, while the government is making sure that, there are activities to mitigate these things. The new normal has to happen sometime, Mr. Ladi. It can't go on like this. People are being alienated of their livelihoods, of their education. It's just that we have to do it consciously, while making sure that, people do not suffer too much from this disease.
Dr. Ajoke Adewale, thank you so much for your time, and thank you particularly for the optimism that you displayed there at the end. Dr. Adewale Ajoke joins us via Skype from Isolo in Lagos. Thank you very much for your time. Now, let's show you what the COVID-19 situation report for Nigeria looks like at the moment. 25,694, that's the total number of confirmed COVID-19 cases in the country. Of this figure, close to 10,000 patients have been discharged, while 590 people have sadly been lost to the disease, leaving 15,358 as active cases in 35 states across the country, plus the Federal Capital Territory, with 138,462 samples tested so far. The male gender still leads in the number of infections, accounting for 66% of the cases, while the females are 34%. More and more cases are as a result of unknown exposure. That's 73% of the entire caseload, and this has been described as community transmission. States with the highest cases in each of the 6 zones are Lagos in the southwest with 10,510 cases. The FCT in the north central has 1,870, and Kano in the northwest 1,216 cases. Edo State overtook Rivers in the south-south with 1,105 cases. Gombe and Bauchi now lead in the northeast with 503 cases each, while Ebonyi tops in the southeast with 438 cases. Joining us from our Abuja studios is a public health and project management expert, Dr. Omede Ogu. Good evening, Dr. Ogu. Thank you for your time, and particularly for your patience.
Good evening.
What do you think the figures that we've just described, I mean, it seems as if we're not galloping, but we're cantering towards higher numbers now, 25,000, more than 25,500. What do you make of these figures?
Yes, the 25,000 or more cases that have been reported is a reflection of the progress that has been made internally, I mean, in the country. You remember very well when the index case was first reported, for us to even get actual reports of confirmation of the index case took a lot of days, hours, and weeks for us to arrive as a country as a confirmed case for COVID-19. Between that time, that is February 27, and now, a lot of progress has been made by the national government and state government with the private sector, with a lot of resources coming in, setting up infrastructure and equipment to improve on the previously existing equipment. And I think the numbers we are experiencing now is coming from the fact that more people are willingly submitting themselves to for tests, and then more tests are being carried out.
Seems to come up from time to time is the issue of frontline workers and their exposure to this, to COVID-19. From your own assessment, from what you've seen, is this a function of the fact that they do not have the requisite equipment, or is it that they don't have the requisite training in the handling of this equipment, or what exactly is it?
I think you should come back on that question again, because I think what you're asking is contradicting what I've just talked about.
No, my question, no, it's not contradictory. My question is about frontline health workers. I'm talking about the health workers now, those who are treating patients with COVID-19. And I'm saying that from time to time, issues come up that seem to talk about significant numbers of those frontline workers getting infected themselves. And so my question is it one of lack or a shortage of supply of PPEs and other such equipment to protect them, or is it a function of training on the use of those equipment, or what?
Yes, okay, thank you very much. In my opinion, the frontline health workers are properly trained. And then the equipment that are available for them to be used are the same equipment which they are exposed to in training. But because coronavirus or COVID-19 is a novel virus, there's still so much that is not known about it. And so one cannot tentatively say what are the best guides to be put up to prevent the frontline workers from being infected. It could be linked to so many factors, either from the procedure of sampling or from the direct contact with the patients or through some other means. It could be multiple. And like the earlier speaker talked about, it is novel, and so many research is currently going on to learn more about this disease. And I think once those research outcomes are out, we'll get to know some of the finite details that result in the exposure of the health workers to this deadly virus.
I will ask you the same question I put across to the good doctor just before you, and that is that interstate travel has reopened, airports will reopen from next week, schools will somewhat reopen, particularly for graduating students. So we are going back to some level of normality. Are you afraid that this could also lead to a significant challenge in terms of the numbers of cases that we'll be dealing with?
Well, in the practice of medicine, we say, never say never. The fear could be there, but I think the government and the regulatory authorities at the national level and at the state level must have put in some measures in place to curtail this. But on a general consideration, what I would advise the state authorities and their local authorities to do is to reassess their currently existing policies on COVID-19 and see how that supports their population, their state-specific population. Then for the schools, they could also look at specific school policies and see how that supports the students, their parents, the staff, that is the teachers and the supporting staff of the various schools that have been now, encouraged to open. Beyond that, I'll also ask the state, the schools specifically, to set up solution committees that can look at the advice that are given at the national level and at the state level, or by the national authority and state authority, and see how they strictly, in attempt to implement those policies, they stick to best practices in rolling out those policies. In doing that, it will be very helpful. But on the other hand, again, looking at flexible arrangement that schools can put in place, they can reduce their work hours and then increase sharing of responsibility, and then possibly also consider mandatory testing. The only challenge we are having, I mean, in overall control of COVID-19 has to do with testing. A lot of people who are positive are asymptomatic and they don't get to know their status. So any measure that will put mandatory testing in place will be very, very encouraging, and then it will improve overall management of COVID-19.
Thank you very much, Dr. Omede Ogu. Thank you so much for your perspectives on that. I will thank you for your time on the program this evening. Thank you for your time.
Yes, thank you.
Now, beyond our shores, more than 12,000 people in the United Kingdom are set to lose their jobs after many firms announced cuts in the past 48 hours. The cuts are mainly being made by high street retailers and in aviation, two of the sectors hardest hit by the coronavirus lockdown. The UK's death toll from confirmed cases of the coronavirus rose 176 on Wednesday to 43,906 from 43,730 the day before, and that's according to government. Juliana Olayinka has the details.
Life in lockdown again. Leicester, an English city of around 330,000 people, will not be easing lockdown measures with the rest of the country on Saturday, as promised by Prime Minister Boris Johnson. Instead, the city is moving backwards. In the overwhelming reaction from business owners is shock, anger and confusion.
Devastated, a little frustrated because we were preparing ourselves from the 15th of June onwards to go back to some form of normality. But it's going to have a huge financial impact on us. But of course, the bigger picture is, I think, it's important that people's safety come first. So the safety first approach is probably the best thing, because we don't want people, dying basically.
According to the British Health Secretary Matt Hancock, the 7-day infection rate in Leicester was 135 cases per 100,000 people, 3 times higher than the next highest city. Leicester also accounted for 10% of all positive cases in the UK in the past week alone. For Boris Johnson's Conservative government, isolated lockdowns such as these are the only way to tackle the pandemic. The UK has been the European country worst hit by the coronavirus in terms of fatalities, with the death toll from confirmed cases of COVID-19 now standing at almost 44,000. There are concerns, however, that information is trickling down to local councillors far too slowly.
If, as seems to be the case, the figures suggest that there are issues in the city, I would wish that they had shared that with us right from the start, and I wish that they had taken a more speedy decision rather than leave it, 11 days, I think it was, from the Secretary of State's first announcement through to actually announcing that there was going to be action. That's a long gap and a long time for the virus to spread.
With the reopening of pubs taking place this weekend, public health officials predict that Leicester is the first in the long list of English regions that will go back into hibernation. Juliana Olayinka, Channels Television News, London.
Juliana joins us now via Skype from London. Good evening, Juliana. Now, John Lewis, W.H. Smith, Topshop are just some of the major high street retailers that have announced job cuts. Where are these cuts falling?
I missed the last part of your question, Laddie, but I heard the first part, which is about the job cuts in London.
That's right.
Over. Hey,
over the past 24 hours, which have been absolutely staggering. You mentioned Topshop. There's TM Lewin, which I know is a popular store amongst our Nigerian viewers. And the list goes on and on. We've also had Airbus announce that they'll be cutting 15,000 jobs across Europe. John Lewis, which is a really popular department store here, they said they will never reopen some of their stores, and it's completely worrying. I think for Boris Johnson, the labour market is really his focus of attention because you know, everybody knows that the furlough scheme, which has been heralded by leaders across the world, will be coming to an end. At the moment, the government is paying the wages of millions of people, but they cannot do it forever. And there are concerns that as soon as it does taper off, employers will be making mass redundancies.
Well, given the fact that it does seem like in most other places, this is a balance between life and livelihoods, we're told, given the fact that now that things are being eased up a little, we're expecting some level of that to happen on July the 4th, I believe it is. What are the preparations on that against the backdrop of this job cuts?
Well, there are several stories there, Laddie. I've got to go back to what has been put into my report, which is about the city of Leicester. Now, this is a major story here in the UK because, as you said, in a couple of days' time, the hospitality sector, which is Britain's most important sector, will reopen on the 4th of July. Pubs, hairdressers, salons will finally be able to open their doors. It is a Saturday. It is the weekend after payday, and I'm sure it doesn't take much for many people to recall Britain and drinking and what that does to one another. So there are some concerns that what we've seen in Leicester, which has taken the city centre by complete surprise, will happen in other cities. There is already a list of about 36 other cities across the UK. Many of those regions are in London that will perhaps get a local lockdown. And of course, what that does mean is the preparations, as you referred to, in terms of making sure your staff are trained, making sure your facilities are COVID-19 secure, which will cost you potentially thousands, will go to waste. So there's a lot of confusion at the moment. Prime Minister Boris Johnson was definitely on the defence during Prime Minister's questions today by Sir Keir Starmer, the opposition Labour leader, as to why it took so long for them to talk about the second lockdown in Leicester, and perhaps the fears of what may happen on Saturday evening once people have a couple of drinks down their system and forget to social distance.
Juliana, thank you so much for that. Please stay safe. Even while all that is going on, please stay safe while out there. Juliana Olayinka from our studios in London. The NCDC continues to work closely with states, find out all the details on their website. The WHO also has all the details of national and international responses. Do watch channelstv.com for the details of all the stories relating to the pandemic and indeed other stories. That's our COVID-19 update tonight. Thanks for being with us. Good night.